On something that's not related to COVID directly, but it's related to border security, and it's related to the impact on current border policies that we are experiencing here in Arkansas. And DHS has drawn my attention to this because we are now seeing a number of unaccompanied minors that are coming into Arkansas to be housed with their sponsors. In fact, in the last federal fiscal year, which ended September 30th, the federal government released 672 unaccompanied minors to sponsors in Arkansas. Now, let me underscore that number, 672. Now, when that happens, the federal government should, through their HHS, their Office of Refugee Settlement, will vet the sponsor, make sure that they can handle the unaccompanied minor, and then that unaccompanied minor will be located with that sponsor. What we have seen is that the sponsors are not properly vetted, and that in many instances we're having to take custody of those unaccompanied minors that have been housed with sponsors that are really not properly vetted and qualified and responsible enough to care for these unaccompanied minors. We've seen an increase in the number of calls to our Arkansas Child Abuse Hotline in reference to these unaccompanied minors, and we're taking an increasing number of unaccompanied minors into custody. And in fact, the last month we've had 7 unaccompanied minors who were responsible in the house of a sponsor being brought into DHS custody because of the conditions in which they were living and the lack of care of the sponsor. Some of the children have been abandoned, and others are living with sponsors in conditions that are deplorable. Under state law, DHS has an obligation and a responsibility, and everybody would want to take care of these children, to protect the health and safety of those children, regardless of their immigration status. When an unaccompanied minor comes into DHS custody, we get information from the federal government, but the federal government does not take the minor back into custody if the sponsor is not doing their work. And so what we see is that unaccompanied minors are not eligible for Medicaid or other federal benefits, and this means that whenever they come into DHS custody, we not only have the responsibility for them from a moral standpoint, from a care standpoint, but also from a financial standpoint. And so the taxpayers pick up the tab for medical, behavioral health, and trauma care, shelter and care costs, and the costs of placing the minor in an appropriate setting. This has been brought to my attention. It is a great concern to me, and so I have a letter that I am sending to Secretary of Health and Human Services in Washington, D.C., expressing my concern as mirrored by the concern of other governors, and referencing everything that I just talked about of the number of unaccompanied minors that are in the homes of sponsors that are not being responsible. And I'm asking for a meeting with HHS. I'm asking for a understanding of the vetting process and an improvement of the vetting process. We want to do our responsibility, but we want the federal government to do its responsibility as well, and to make sure that when an unaccompanied minor comes in the United States, that they have a sponsor and that they're properly vetted and they're going to be properly cared for. Obviously, there's other policy changes that ought to be made, but this is a start for it, and this letter will be made available to you.